My name is Emily Carl. I'm a registered nurse. I've been nursing for 15 years and spent a big portion of that time in the oncology ward. And I'm also a naturopath. I've gone on and done some postgraduate study in cancer nursing, and I'm currently studying with the American Institute of Integrative Oncology. I work at a clinic in Lower Plenty in Melbourne, and I'm part of a team there that provides adjunctive oncology support to patients. So what do we know? We know that oncology patients are using complementary medicines. Around 45 to 90% of oncology patients are using complementary medicines, and about 33% of patients don't tell their oncologist for a range of different reasons. Often the herbal or nutritional supplements are self-prescribed and not necessarily with a full understanding of the potential interactions with conventional treatment or medications. The advice is sometimes non-qualified advice, and research shows us that the internet has been identified as a major source of information for people. One thing I'm very strong on is the safe use of complementary medicine. So we need to consider the safety profile of complementary medicines through the whole process of cancer. But if we focus on chemotherapy for a minute, because this is an area that there is a large potential for interactions. So there are drug, nutrient and herb interactions. So when we're prescribing alongside chemotherapy, we need to have a good understanding of the chemotherapy drugs. So the way that they're absorbed in the body, the way they're metabolized and eliminated. And also I always avoid treating in the therapeutic half-life of the drug. And what I mean by that is a period, a sort of a window around chemotherapy where we know that if we treat outside this window, we're less likely to have any interference with conventional treatment. And the other thing that's important to know is not to make inference across different chemotherapy drugs or even across different types of cancer. So what may be useful alongside one chemotherapy may actually interact with another one. So the role of the adjunctive care model. So my role is to support my clients through their conventional treatment, whether that's surgery, chemotherapy, radiation, immunotherapy, and always looking at the safety, so the safe administration of complementary medicine. And some of the things that we're aiming to do are to reduce side effects. So whether that's side effects of the cancer itself or side effects of the therapies that people are having. Always making sure that we're avoiding any negative interactions, so having an understanding of which herbs or nutrients can interact with particular therapies. People who are engaging in adjunctive care often have an improved compliance to treatment, and that's because of the reduction of effects. But also what's really important here is that we're able to get people through their treatment, hopefully without having to dose reduce chemotherapy or having delays in chemotherapy due to side effects. We're always looking to enhance any potential positive interactions. So there are certain herbs and supplements that have been shown to improve the efficacy of conventional treatment and also to sensitize cancer cells to chemotherapy or immunotherapy. Reducing the risk of recurrence. So this is where complementary medicine is really well placed. And I think it's one of the things that we do particularly well. And part of that is trying to get an understanding of some of the reasons why cancer may have developed in the first place. And that can then help us know if there's anything we need to change in terms of diet or lifestyle, if there's any supplements that people can take that can help to reduce the risk of cancer coming back. And then obviously wanting to improve quality of life is really important. So as I said, I work at a clinic in Melbourne and we have part of the team there is Ancora team, and that's just a group of practitioners who we sort of work together and provide adjunctive care to cancer patients. And we don't consult with patients that aren't seeing an oncologist or following their recommendations. So some of the reasons why people seek out naturopathic care. So often it's to reduce side effects. So I have people coming to see me at all different stages of their cancer treatment, whether it be before they've started, during, or even after. People looking for dietary advice, when they're wanting to be proactive in their care and know if there's anything else that they can be doing. when people are looking at ways to reduce the risk of recurrence and also improving quality of life. And I guess one of the important things to mention here with naturopathy is what we're always trying to do is identify the underlying cause of what's going on. So what that means is that if we can work out the cause of whether it's a symptom or a process that's going on in the body and treat there, we know that we're going to get the most improvement and we're going to be able to address the symptoms properly. Just got a little safety reminder here. Before starting any new herbal or nutritional supplements, please check with your healthcare practitioner because, as I said, not all herbs or supplements are suitable for every person, and particularly if you're currently undergoing treatment or taking any medications. I think sometimes people believe that because something is under the banner of natural medicine that it's inherently safe, but this isn't always the case, and this particularly, I guess, applies alongside other therapies, so chemotherapy, immunotherapy, or if you're on any other medications, because there are known drug-herb-nutrient interactions. So what I thought I'd do now is go through some of the side effects that my clients frequently present with, and just talk a little bit about the complementary medicine sort of treatment and the sort of things that I'd be looking at doing. So let's start with myelosuppression. So myelosuppression is just a reduction in the blood cells in the body. So whether it's red blood cells, platelets, or white blood cells. And this is something that commonly occurs alongside particularly chemotherapy. And that's because chemotherapy acts on the rapidly dividing cells in the body, and our blood cells are some of those rapidly dividing cells. So anemia is a low red blood cell count. Thrombocytopenia is a low platelet count, and neutropenia is a low level of neutrophils, which is one of our white blood cells. So firstly, in looking at what the potential causes are, so obviously we know treatment does do this, but also we need to consider with, say, anemia, so a low red blood cell count, is there anything else going on? So it can be due to the cancer itself, can be a side effect of the treatment, but it can also be if there's any bleeding or any nutritional deficiencies as well that need to be addressed. And so the sort of things that we would look at here is there's certain herbs. So research shows us that there are particular herbs that if they're given alongside chemotherapy, that they can reduce this myelosuppression, so sort of prevent this drop in red and white blood cells. Medicinal mushrooms are fantastic here. So mushrooms are probably one of my favourite supplements because there is a lot of research into the way they improve the immune system functioning, but also into the way that they can reduce side effects alongside conventional treatment. Fasting around chemotherapy. So we're starting to see more research come out about fasting. And when people fast around chemotherapy, there can be a protective effect on the normal cells of the body, and it can also increase the uptake of chemotherapy into the cancer cells. But if this is something that anyone is interested in or wanting to do, you really do need to do it with professional assistance. Fasting isn't right for everybody, and so having support and someone guiding you through that is really important. And then from a medical standpoint, sometimes people will need blood transfusions if their red blood cells are too low. One of the causes, as I said, of anemia can be nutritional deficiencies, so iron particularly. So it may be that someone needs to take an iron supplement or have an iron infusion. And we can also do infusion of platelets as well. And there are some injections that can be given post-chemotherapy to stop that drop in white blood cells. Next is anorexia, and anorexia is just loss of appetite, and often it can also come along with weight loss as well. So again, really important that we treat the cause or try to identify the cause of why someone has lost their appetite. So it can be part of the disease process. It can be more because someone's experiencing taste changes or smell changes. It just means that they're no longer as interested in food. Mouth sores as well can cause a loss in appetite, nausea, and also inflammation. So the treatment's going to depend on what's contributing to it. But the sort of things I recommend is having small, frequent, high-calorie meals. And when I'm talking about high calorie, I'm largely talking about good, healthy fats to help boost the calorie content of meals. And eating smaller amounts more frequently throughout the day can sometimes help. We need to address any contributing factors. So, for example, if nausea seems to be the thing that's driving it, then we need to treat the nausea. If there's mouth sores, then we need to address that. Digestive enzymes can sometimes be helpful because if we're not able to break down our food properly, digest our food properly, it can cause a loss of appetite. Medicinal mushrooms, again, there's quite a bit of research into their use alongside treatment in preventing appetite problems. And we're starting to see more research into CBD oil and the way that it can help to stimulate appetite in some people. So constipation. So constipation can come from a variety of different reasons. It can be medication induced, and particularly here, opioid, analgesic, pain relief medications and anti-nausea medications are quite well known for causing constipation. It can be because someone's dehydrated, so they're not drinking enough. Sometimes it can be more of a structural issue. So if there's an abdominal or a pelvic mass, or some radiation fibrosis or a bit of scarring from radiation. Diet, so particularly a low fibre diet as well is going to cause constipation. Inactivity, dysbiosis, and what I mean by that is an imbalance in the bacteria in the gut. So we've all got trillions of different bacteria in our gut that we need for health. And one of the things that chemotherapy does do is that it can kill off some of that bacteria in the gut and end up with just an imbalanced gut microbiome. And our gut microbiome really is at sort of the centre of health. So it is necessary for good immune function. It obviously helps with breaking down our food, absorbing our food, but also even things like our nervous system function and neurotransmitters are all impacted on by our gut microbiome. So sort of getting that back into balance is really important. And again, not making enough digestive enzymes. So your body's just not able to break down the food properly. So the sort of things that we would need to look at here is, number one, make sure that someone's drinking enough. Just because that is really sort of common in one of the causes of constipation, that you're getting out and getting a bit of exercise or activity to help things move through your gut, making sure that you're getting enough fibre. So high fibre diets are contraindicated in anyone who's at risk of a bowel blockage, and also after surgery, specific surgeries, often people will be put on a low fibre diet for a period of time. But otherwise, if you're looking to increase your fibre intake, doing things like adding ground flax seeds to food or smoothies, getting enough fruit and veggies, things like oats, legumes, nuts and seeds, they'll all be beneficial in boosting fibre intake. And sometimes people do need to also use fibre supplements as well. So that's something we can do if they're not able to get adequate fibre through their diet. I guess one thing here with fibre supplements is start slowly and build up. Because if you're not used to eating a lot of fibre and you suddenly increase your fibre intake, you can get some gut pain and cramping and bloating as well. So just doing that slowly. Probiotics. So probiotics are certain strains of bacteria that are known to be healthful for the body. So these are supplements that can be taken. And there's quite a lot of research into different probiotics and the effects that they can have on health. And so there are particular probiotics that we know are good at helping reduce constipation. Prebiotics are just the food that your bacteria in the gut feeds off. It's a type of dietary fibre, and it's the non-digestible part of food. So some examples of prebiotics are onions, garlics, bananas, apples, a lot of your fruit and vegetables. And we need those to help grow that healthy bacteria in the gut and improve the gut microbiome. And again, sometimes I do prescribe prebiotics as supplements as well, if people aren't able to eat them in their diet. Abdominal massage has been shown to help with constipation. And then we've also got a range of laxatives as well that can be used if needed. So diarrhea. So diarrhea can be a consequence of chemotherapy, and that's largely because chemotherapy can damage the enterocytes or the cells in our intestines. And one of the things it can do is affect the ability of our gut to make specific enzymes that we need to break down our food. So, for example, with 5-FU, a certain chemotherapy, that can actually create a bit of a transient lactose intolerance. So, where people are having symptoms after eating dairy. And that's just because it affects the body's ability to make lactase, which is the enzyme needed to break down the lactose in dairy. So sometimes there's specific foods that you may not be able to tolerate during chemotherapy for those sorts of reasons, but generally after chemo, once your gut has a chance to regenerate, we can put those sorts of foods back in. Infections can be a cause of diarrhea, so obviously having a reduction in white blood cells lowers our immune function and makes us more susceptible for any sort of infections, including gut bugs. Having a reduction in our pancreatic enzymes, again, can cause diarrhea. Dysbiosis, so that imbalance of bacteria in the gut I was speaking about, and sometimes it can be an effect after surgery while your digestive system and digestive function is sort of settling. So what do we need to think about with diarrhea? Number one is making sure that you're maintaining good hydration so that you are getting enough fluids and don't become dehydrated. If there's a problem with pancreatic enzyme production, then pancreatic enzymes can be really helpful here. So something like Creon. Again, there's specific probiotics that have been shown to help reduce diarrhea. Fibre can be helpful here too, so more at bulking up the stool. Sometimes we need to make some dietary changes. So as I said, it may be avoiding dairy or avoiding gluten. And often that's only, during chemotherapy and just after, and then those sorts of foods can be brought back in once we've done a bit of work on regenerating the gut. And then looking at a couple of specific supplements, glutamine and zinc. So glutamine's an amino acid, and then we've got zinc, which is a mineral, and they're really important for the health of our gut cells and our gut lining. So they can help with regenerating the gut. And then we've also got the antidiarrheal medications, so things like Lomotil or loperamide that can be really beneficial here. Dehydration. So again, this can be caused by different reasons. It can be because someone's not got a great appetite, they're not really feeling like drinking. It can be if there's any mouth sores or mucositis, changes in taste, and then obviously vomiting or diarrhea. So again, it's important to identify what's causing it because there may be other things that we need to address in order to help improve it. So sipping small amounts throughout the day can be helpful, just particularly if you're not able to tolerate a large amount in your stomach in one go. I always encourage people to keep fluids close by, so keep a water bottle near them, whether they're leaving the house or even in the house, just it's a bit of a reminder to keep your fluids up. Sometimes the taste of water, you can get a little bit sick of it, so adding something like lemon or orange can help with that. Herbal teas can be great here just to mix things up a little bit, and they've got their own therapeutic benefits as well. And also increasing your water-rich foods, so things like soups or stews, fruits or vegetables have their own water content, so that's going to help boost your fluid intake for the day. And then avoiding anything that's going to be dehydrating to the body, so caffeine and alcohol, because they're just going to increase your fluid loss. Dry mouth. So dry mouth is another common side effect, and it can be to do with medication. It can be because we've got a reduction in saliva production. If we're dehydrated, that's going to definitely cause a dry mouth, and mucositis or sores in the mouth as well. So saliva plays a really important role in our health. So it's actually got a really protective function. So it protects our mouth and our esophagus. It protects our esophagus from any acid reflux from the stomach, and it also is the first stage of digestion. So having good saliva production isn't just good from a comfort point of view, but it also has its own sort of beneficial actions in the body. So number one probably is maintaining adequate hydration. I don't think we can underestimate the impact that being dehydrated has on our ability to produce saliva. There are different saliva substitutes that we can use, things like biotin, even rinsing with warm water and salt or baking soda. Again, we want to avoid anything that could be dehydrating, so alcohol and caffeine. And acidic and spicy foods can be irritating to the mouth, so they may need to be avoided for a period of time as well. And then if we're looking at supplements, zinc's really important for saliva production, so it can be beneficial here. Echinacea, which is a herb, and I often get clients to make up a little mouth spray just with water and echinacea, because it does have the action of causing your mouth to produce more saliva. And then we've got melatonin. So melatonin you need to get a prescription from your doctor, but there's actually a lot of research in melatonin and its benefits in terms of cancer. But it can help to improve saliva production as well. And acupuncture is another way to help. Then if we're talking about dry mouth, we probably also have to talk about mucositis. So the mucosa is the thin outer layer that lines most of our organs, so including our mouth, our throat, our esophagus, and our whole gastrointestinal tract. And mucositis is the breakdown of these epithelial cells. And also and sort of inflammation within the gut as well. So often it's caused by chemotherapy. Epithelial cells are some of those rapidly dividing cells in the body, so they can be affected. And you can end up getting increased risk of ulcerations or mouth infections as well with mucositis. Typical sort of symptoms are any painful spots or sores or ulcers in the mouth, bleeding, mouth infections like thrush, and it can cause a lot of pain and difficulty with eating or swallowing as well. So in looking at helping to prevent and reduce mucositis, avoiding alcohol and alcohol-based mouth rinses just because they are more drying to the body, and also avoiding spicy and acidic foods just because that can increase the damage of our mucosa or those epithelial cells. Zinc, because of its wound healing properties as well, can be really beneficial. There are some studies on the use of Manuka honey. So honey has some great wound healing and antimicrobial and anti-inflammatory actions, and research has shown that using that can help prevent or reduce the severity of mucositis around chemotherapy. I'll often use a bit of a mouthwash with some liquid zinc and glutamine that's quite effective. Just washing with a salt water mouthwash can be really helpful. And then there are some things that are more for reducing pain and comfort. So a Pink Lady, so that's a mix of xylocaine viscous, which is like a local anaesthetic, and something like Mylanta, and also sometimes cocaine mouthwash we used to use in hospital as well for people who were having a lot of pain and a lot of difficulty eating. Fatigue. So fatigue's a really common side effect. And again, there can be multiple different causes. So we really do need to sort of identify what's driving it. So it can be, excuse me, to do with anemia, so a low blood cell count, to do with treatment. That's going to reduce your hemoglobin in the body and reduce the oxygen traveling around your tissues. Nutritional deficiencies can contribute to fatigue, so particularly things like iron, B12, folate, not getting enough protein. Infections cause fatigue. If there's any mood problems or sleep disorders as well. Certain medications can cause fatigue, pain, causes quite a lot of fatigue, and inflammation, so systemic inflammation around the body. Causes, it's sort of a protective response for the body, but that can cause fatigue as well. So again, the treatment's going to differ depending on what's sort of driving or causing the fatigue, but exercise is a great treatment for fatigue. There's a lot of research into the benefits of exercise. Mindfulness and meditation as well can help with fatigue. Diet, so making sure you're getting all of your macronutrients and micronutrients. and all of the nutrients you need for your body to produce energy. B vitamins are particularly important when it comes to energy production in the body. Certain herbs, they're called adaptogenic herbs, and they help with the adrenal function in the body and help with the production of energy. Acetyl-carnitine, which is an amino acid that we need to make energy or ATP in the body. Coenzyme Q10 is another supplement that we can use. It's something that we all make endogenously in our body, but sometimes our production can't keep up with our need. So I will at times supplement with CoQ10, and acupuncture has been shown to help with fatigue as well. Nausea. So nausea is a common side effect, particularly of chemotherapy, but also immunotherapy and sometimes radiotherapy as well. Digestive dysfunction. So if your body is not able to break down the food properly, digest the food properly, it can contribute to nausea. Constipation is a big cause of nausea, as is pain, and also gastritis. So gastritis is just inflammation of your gut lining, and that can occur with chemotherapy. So having more bland foods, low odor foods can be beneficial. Eating small amounts but more frequently throughout the day. I'll often use ginger as a tea or ginger tablets to help with nausea. Acupuncture can be really great here. Can be really beneficial for nausea. And then we've got a range of different anti-nausea medications as well that can be used. If nausea is more so due to gastritis, people will tend to sort of complain more of a queasy type feeling, and they generally feel better after eating. If it is gastritis-induced nausea, then treatment would be slightly different, because we'd be more so looking at reducing the inflammation in the gastric lining, and so using really soothing herbs like marshmallow root or slippery elm. And in these sorts of cases, ginger can actually make the nausea worse. Peripheral neuropathy. So peripheral neuropathy is a common side effect with particular chemotherapies. So it's a damage to the peripheral nerves that occurs from chemotherapy, and it's more common in some of the platinum chemotherapies like carboplatin or oxaliplatin, some of the taxanes like Taxol, and it typically presents as can be a numbness, burning, tingling, a reduction in sensation, often starts in the fingers and the toes, but it can progress further, and it can even reduce strength and movement as well. So acupuncture has been shown to help reduce peripheral neuropathy, so can exercise. And then we've got different nutritional supplements, but these will depend on the type of chemotherapy that you're having, because some of the supplements that are beneficial for one type of chemotherapy can also actually increase the risk of peripheral neuropathy with another type. So making sure that you're getting some guidance as to which supplements to use is really important here. And again, melatonin. So there's research using melatonin, reducing a number of different side effects from treatment, but also peripheral neuropathy. And then lastly, I just wanted to make a comment about vitamin D. So vitamin D is extremely important to our health as a whole, but there are a number of studies that having a higher vitamin D status can reduce the incidence of cancer and also improve the prognosis for a number of different cancers. So they're still not 100% sure exactly how vitamin D works in terms of its function within sort of reducing cancer and improving outcomes, but they know that it helps to decrease cancer cell growth. It can stimulate apoptosis or death of cancer cells, and also inhibits angiogenesis, which is just a creation of blood vessels to get more nutrition to the tumours to allow growth. Vitamin D is also really important for our immune system. So for proper functioning of our immune system, we need good vitamin D levels, and it can also help to reduce inflammation. So just as an example, there's a study that shows that higher vitamin D levels demonstrated improved survival in pancreatic cancer. But there's a number of different studies across the various different types of cancers. So one thing is we can test vitamin D levels, so it's tested on a blood test. There's not a great consensus for what is the best range to have your vitamin D levels in. So the more recent research is showing us that vitamin D levels above 100 nanomoles really are where they need to be in terms of looking at cancer protection and alongside treatment. Now, one thing to remember is that vitamin D is a fat-soluble vitamin, so it is stored in the body, which means that you can have too much of it. And that's why getting your levels checked is really important, and discussing any supplementation with your healthcare practitioner just to help determine what dose is best for you. And then, continuing to check your levels to make sure that we're not getting the level too high. Also, if you have high calcium levels, you need to be careful with vitamin D supplements because that can further increase your calcium levels. And so that's it for me. Thank you very much for listening. I hope that I've been able to just give you a bit more information on the use of complementary medicine in adjunctive cancer care. And if you have any questions or anything, feel free to email me. I've put my email address up on the screen there.